So hymenoplasty is a reconstructive surgery which is done to repair or reconstruct the hymen. So I'm Dr. Gynaecology. I'm a cosmetologist based at Kyra Aesthetic Clinic, Ludhiana. So we'll be talking about hymenoplasty surgery today. It's also called hymen repair surgery or revirginization surgery because this surgery is done before wedding by the females. So what is hymen? Hymen is a very delicate membrane which covers the introital opening of the vagina. And to discuss what are the causes which cause a rent in hymen or rupture of hymen. It's very obvious that the most common cause of rupture of hymen is sexual intercourse, but there are other reasons also. Many things like trauma or fall or use of tampons or excessive gymming or cycling or horse riding, they can also lead to rent in the hymen. Some vaginal surgeries, like as if for any vaginal cyst, that can also cause a rent in hymen. So these are the other uncommon causes, but the most common cause is anyway sexual intercourse. The most common question which I experience in my practice is when it should be done. Ideally, when we do hymenoplasty, it takes almost 3 to 4 weeks for full recovery. The stitches which we apply, they are absorbable, and in 3 to 4 weeks, the stitches are well absorbed and the patient is very good to go. But my suggestion is that before wedding, at least the client should get hymenoplasty surgery at least 2 months before her wedding, 1.5 to 2 months. Why? Because once this thing is settled, the client is very assured that this situation has been taken care of and she can focus more on other things like shopping and other celebrities which have to be done before the wedding, and she should be ready for her the D-day or the final day. So ideally 1.5 to 2 months before the wedding. It's done either for the religious or cultural reasons, but the most common cause, the reason for getting a hymenoplasty done is personal. Nowadays this is very popular, and everybody, they want to get ready for the wedding and they want to do it as a gift for their husband. So this surgery, it enhances the confidence of the female, so most of them, they prefer getting it done before the wedding. So now about the surgical technique. Hymenoplasty can be done either under local anesthesia, but most commonly we prefer some IV sedation or short GA because this relaxes the pelvic part, the lower muscles of the female, and especially the female is also very comfortable. They go to sleep and we can do our part easily. The hymen, there are remnants of the hymen. So the remnants of the hymen, they are stitched together, and we do it in a double layer because we have a plastic surgeon here, Dr. Kavdi. So he does the surgery himself. We try to do it in double layer so that the hymen is stitched properly and it doesn't rent again. It takes almost 1.5 hours, so it's a daycare surgery. The client can go back to his home, her home, the same day. And it's a very safe and easy surgery. There are not much precautions. You can go home and rest on the same day. From the next day onwards, you can do all the routine activities. There are just a few precautions that don't do any strenuous activity, no exercise, no gymming. You can climb the stairs, thoda bahut, but not much of, like you don't have to exert yourself. And obviously avoid any kind of sexual intercourse or any physical intimacy. That's the main thing. Rest, you have to be on oral medication for 4 to 5 days. The stitches are absorbable, so there is not much need of any follow-up visit. The only thing is when we plan a hymenoplasty, we make sure that the patient is free from her menstrual periods. It's not that we cannot do it during the periods, but once you are free from the periods, the healing of the stitches is much better, and sometimes there is some spotting or something after the surgery, so there is no confusion whether this is spotting or it's from the menstrual bleeding. So the ideal time to get it done is once you are free from your menstrual periods.
You have seen all the details regarding the hymenoplasty surgery. Yes, the results are very fruitful. So as a plastic surgeon, we can create a new hymen also, because if there are remnants, suturing of the remnants is very easy. We do it in the double layer. but we can take some flaps from the mucosa and we can create a new hymen also. So hymenoplasty surgery takes only 1 hour and the patient can go immediately back and she can start her new life after just 1.5 to 2 months. Thank you.
We get many redo cases also, clients who have got done the hymenoplasty from any other center but they don't get the desired result. So it's our effort at Kyra Clinic to do the job properly so that the females are well assured and they are tension free. The confidentiality of the patient is very well maintained over here. We know that this is a very private surgery, so we do everything to maintain the privacy of the patient. You don't feel hesitant. You can always call us and book an appointment with us. We have, myself, Dr. Rajni, we have female counselors who can explain you everything regarding the procedure and prepare you for your final day. Thank you.